Hi, my name is Jessica Buzlog. I'm going to be doing a sterile dressing change skill today. I'm in my Nightingale scrubs with my name badge attached. I have gathered all of my supplies and they're on a clean, dry surface. I'm doing hand hygiene. And I'm going to introduce myself. Hi, Mr. Jones. My name is Jessica. I'm going to be your nurse today. We're going to do a sterile dressing change on your wound. But first, I need to verify you with your ID band on your wrist. It does say Austin Jones, and your birthday is 8/18/73. Is that correct? Okay, great. With my clean hands, I'm going to put on my gloves. Mr. Jones, today when we're working on your bandage change, I'm going to ask you do not touch your wound, your bandage, or any of my sterile supplies. We're going to keep a sterile field today. This is my biohazard waistband. Waste bin, and I'm going to stay everything dirty to my right and everything sterile to my left. I'm going to begin by checking the wound, lightly palpating the bandaged wound. I'm going to hold the skin firm and kind of peel at the corner to start loosening the edges, holding the skin firm while I loosen all of the edges around the bandage. We're going to do this with the hair growth pattern toward the center of the wound so that we don't lift any skin or pull or tug on any of the wounded area. It's completely loosened now on the edges. I'm going to lift this away from the wound directly up. I'm going to pinch this in half and place it in my biohazard waste bin. I'm done with these gloves now, so I'm going to remove by holding the center and pulling away from my fingers, balling this up under the cuff here, pulling over, touching the outside only, and put that in my biohazard waste bin. I'm going to do hand hygiene again. I'm going to get my sterile glove kit out of the package here. Now I'm behind my wound here and away from my biohazard bin, and I'm just keeping my kit in view. There are several inches between the edges of my wrapper of my glove kit. Also, my waist is not touching the table I'm working on. There's about 6 inches here. I'm going to get the margin here and open up my gloves. And I'm going to maintain a 1-inch margin at least. I think it's 2 inches at least, never going within that edge of the package. I'm going to take these fingers and get my first glove and maneuver my hand into this glove, keeping this cuff, very good, on my glove. I'm going to take these fingers and get my glove, there we go, with my thumb out. And I'm going to maneuver my fingers into this glove. I'm going to touch the center of this wrapper and place it into my biohazard bin. I'm going to now consider this my hand that I'm working on the wound with, and my dirty hand, so to speak, and this is my sterile hand. I'm going to palpate and assess the wound. I'm going to look at the wound for skin type, texture, color, looking for any odor, any edema. I'm going to palpate lightly around the wound to see if that changes anything, assessing pain level. And Mr. Jones looks like he's doing okay. So I'm going to go ahead and begin with my ChloraPrep, my clean hand into my kit that's totally visible, and I'm going to drop that into my dirty hand. I am going to, for the purposes of this video, I'm going to say that I have 2 of these. I normally would in the real world, but I do not. I only have 1. So I'm going to click it and clean the inside of the wound. This one, I would dispose of it into my biohazard can, but I only have 1, like I stated before. So I'm going to pretend that I got myself a new one, dropped it in my hand, click it, and I'm going to clean the outside with the second wand. Now I'm going to dispose of it in my biohazard can. I'm going to get a clean gauze, drop it, and I'm going to pat dry the inside of my wound. And I'm going to drop that into my biohazard trash bin. I'm getting a new clean gauze, drop it, pat dry the outside of my wound, dropping into my biohazard bin. I'm going to get my bandage. I'm going to loosen it from the backing with my 1 clean hand. Now I can use this hand to remove the backing. I'm going to drop that into my biohazard bin. I'm going to touch the outside white wrapper and place this bandage onto the wound. We're going to work lightly from the inside out and smooth and attach the clear bandage onto the skin. In the real world, I would have removed the white border on this clear bandage. I'm going to leave it there in case of remediation. And I also would have initialed, dated, put the time on the bandage so that we can communicate with whoever checks the wound later. At this point, I'm okay to remove my gloves. I'm going grabbing from the center of the palm, pulling away from my fingers. It's tight, but I got it. Balling that up, my fingers under this cuff and pulling over, dropping into my waist bin, keeping my hands up the whole time. Okay, I'm going to do hand hygiene again. I'm going to ask Mr. Jones if he's comfortable. I'm going to chart my procedure. I'm going to close the door for privacy. Before I closed the door, I left his call light within reach, and my procedure is done. Skill complete. Thank you.